Hello, and welcome to all of you, and thanks for joining this important conversation on Black families fighting the flu and why this year is different. My name is Dr. Reed Tuckson, and I'm a physician and a co-founder of the Black Coalition Against COVID, a coalition that includes all of my good friends at blackdoctor.org. Let's be clear right from the start. The flu represents a significant health threat in its own right. But as we will explore with our expert panel, a flu epidemic in the midst of a COVID pandemic can be an overwhelming experience for individuals, families, communities, and for the capacity of America's health system. Just to give you a snapshot of the importance of controlling flu, according to the CDC, from October 1st, 2019 through April 4th, 2020, there were 410,000 to 740,000 flu hospitalizations, and more than 39 million people were affected by flu-related illnesses, many of which were serious threats to individual health. During this show, we will answer your questions on topics such as what is the flu and when does the flu season start? Why do Black and minority communities need to be especially attentive to preventing and controlling its spread? How the flu can worsen other pre-existing chronic illnesses and vice versa. Special concerns for people over 65, special concerns for children. How do we prevent getting and spreading the flu? The safety and effectiveness of different forms of flu vaccines and how you can access them. And we will also talk about where to find trustworthy information. Well, that's a big agenda for our evening. And so to get us started, we have a terrific panel. And let me introduce them very briefly. Dr. Corey Robinson, a physician and the Senior Medical Director of Vaccines for Sanofi, one of America's leading vaccine manufacturers. Dr. Sheldon Fields, First Vice President of the National Black Nurses Association, and Associate Dean for Equity and Inclusion and Research Professor at the Ross and Carol Neese College of Nursing at the Pennsylvania State University. Dr. William Cooper, a cardiothoracic surgeon at Emory University in Atlanta. He is an experienced physician, veteran, speaker, author, and entrepreneur with over 30 years of experience in healthcare. My good friend, Dr. Samira Brown, pediatrician with the Piedmont Healthcare Group in the Atlanta metro area and a stalwart of our National Medical Association. And Lavania Cannon, a healthcare supervisor for Walgreens Pharmacy. Well, to get us started, we have a video that will get us going. And so let me ask for that video to play now. Well, that certainly makes a compelling story, painful though it be, and it ought to energize all of us to make sure that this does not happen to any other lovely family. Dr. Robinson, let's get us started on updating us into the dangers of flu. And let's start with the simplest question first. What is the flu and how does it affect the body?
Great. So what the flu is not. The flu is not just a bad cold. As you mentioned at the top of the hour, the flu is serious. The flu is a viral infection that results in fever, sore throat, cough, muscle aches that can come on all of a sudden. And for most people, they can recover from the flu without much of a problem. But for those persons, particularly those who have underlying conditions like asthma, diabetes, COPD, cancer, the flu can cause some pretty severe complications and even death, which is why it's so important, I'll probably sound like a broken record, but why it's so important to get vaccinated against the flu, to prevent flu and those flu-related complications, especially for those persons at high risk for those complications. And I should add that even for those people who don't have underlying illnesses, the flu can cause some devastating disease and lead to death as well. And we don't know who might succumb to some of those severe complications of death among those persons who don't have underlying conditions. So that's another reason why it's important for everybody for whom it's recommended, that's everybody 6 months of age and older without a contraindication to the flu vaccine, to get the flu vaccine to prevent severe illness and death.
That is excellent. And we will get into those underlying conditions a little bit further as the program goes on. But let me just ask you to remind our audience what causes the flu. A lot of times people get very confused about what the agent is that results in an influenza infection.
Gotcha. So the flu is caused by a virus. It's not caused by a bacteria. So in the case of flu, antibodies are not going to work to try to treat the infection. There are antivirals that can be taken to try to prevent complications from the flu and shorten the course of illness. But the flu is caused by a virus.
Right.
And that virus, the body's response to that virus often results in a robust immune response that results in some of the things I mentioned before, like fever and muscle aches. And sometimes that immune response gets overcharged and causes some of the severe illness and complications that I talked about before, and can make existing conditions even worse. And throw your sugar out of control if you have diabetes, result in asthma attacks if you have asthma. So that response to that viral infection can cause some pretty severe complications.
And since you've got the floor, just remind us when does the flu season sort of start? What's the official kind of flu season?
So flu season is considered to begin in late winter and go until early spring. So typically between October and can go as late as May. I think it's important for people to realize that looking at past influenza seasons, most cases of flu can occur as late as February. So even if you don't get vaccinated by October, as long as the flu virus is still circulating, you can still get vaccinated to prevent some of the complications and disease caused by flu.
Let me turn to Dr. Cooper and then Dr. Fields. One of the things that in terms of the flu season this year, just as last year, is it merged with, we're still in the midst of the COVID pandemic. Dr. Cooper, help us to understand the relationship between the two, between COVID and between the flu.
Yeah, so one of the things that we have to remember that influenza has a propensity, quite frankly, to infect the lungs, or to affect the lungs and the pulmonary system. And that's the same with COVID. These are both viruses. They have a propensity, quite frankly, to begin to proliferate, as well as to create their major effect in the pulmonary system. So that's one of the commonalities. Of course, they're both being viruses, or the various forms of a virus. And also, in terms of their effect on the body, the biggest difference between the common flu that many of us have been aware of all of our lives and COVID is that COVID, you heard very early on in the COVID pandemic that this was, quote, a novel virus, meaning not new. It's been in the environment, quite frankly, for a very long period of time, but novel or new as it was introduced into the human species, which made it so much more devastating. So those are some of the pathways in which the flu and COVID, or the coronavirus, cross in terms of how we think about them medically.
And Dr. Fields, if you sort of thought about a patient who had both the flu and COVID at the same time, can you get both at the same time? And what would that mean to the individual?
So you can get both at the same time. And actually, one will make you more vulnerable. For those who already have a compromised immune system, who may already have COVID, you can get the flu on top of it, which will worsen your condition and, of course, worsen your outcomes, and really could lead to death. And I tell patients all the time who don't believe that the flu is anything to be concerned about, it's just like a bad cold. And as my colleague said at the beginning, it is not. This can kill you. And I don't think people take that very seriously. So, the thing about this is, and I want to make sure that we say this several times this evening, the flu with the vaccine is preventable. And that's really what people can do by getting themselves vaccinated, is to prevent ever coming down with the flu.
Beautiful. Well stated. Dr. Brown, you are a pediatrician, and I could imagine that there are an awful lot of parents bringing a child in and trying to determine whether that child has a cold, has the flu, or has COVID. How do you tell the difference between the three of them?
That's a great question. We have folks who come in, and it's important to come in when your child has fever and symptoms of a cold, because we do want to tease this out. And certainly, like you guys were just talking about, you certainly can have COVID and flu and strep all at the same time, right? And we need to discern between these, because there are certain treatments that we can provide depending on what it is. So there are antivirals that we can use for influenza if you're diagnosed within the first 2 days. And certainly if it's beyond that, there are some kids who will still qualify for treatment. And certainly there are treatment for COVID for kids of certain ages. Strep, needs an antibiotic. But until you come in and we do the test, right, we don't know exactly what's causing that fever. So you need to come in early. We need to do an exam and make sure that you're keeping your child home when they're sick. The other colds and viruses that we see that can cause fever and cough and runny nose and those kinds of things do not typically progress to more severe disease. It doesn't change our treatment plan for kids. So that's why we don't specifically test for other viruses, on a regular basis in an outpatient setting.
Let me make sure that we zone in on this particular point. I want to make sure that we don't have a 1,000 of your patients all running to the office on the very first sign of an illness, or should they? How do you know when, especially we'll talk about kids, and I'll ask Dr. Cooper in a minute about adults, but how do you know sort of when you should contact your health provider?
Certainly, kids who have had fever for more than 24 hours a day, kids who are under 5, all of them are at high risk for complications from flu. So it is important, or if they have household contacts that fall in that age group, or if you have household contacts who are over 50, right? We're talking about high-risk groups, multi-generational homes. And certainly if your child has asthma, if they have problems with their immune system, right? So if they're at higher risk, sickle cell disease. So if they have other medical conditions that put them more at risk for influenza, same thing, all the more reason to come in and get tested early. And also too, making sure that you're staying away from others, or too, if you're around other folks who are sick, make sure that you're staying away. So, we're used to seeing urgent care, same day, appointments. This is what we do in pediatrics. We change our schedule completely in this season, specifically to make room to make sure that we can see our patients.
Great. Dr. Cooper, same thing for adult patients.
Yeah, that's a great question, Reed. I will tell you that COVID has taught us so many valuable lessons. In addition to the things that Dr. Brown talked about in the pediatric population, I will say in the adult population, when you're trying to make that decision, whether or not you need to go to a hospital or sit at home. In fact, I just talked about this on my social media a couple of days ago. I think it's so easy nowadays for you to have in your armamentarium. We all had mom's old Band-Aid first aid kit. Well, you need to add to that, not only a blood pressure cuff, for example. Everybody's got the scale in the bathroom, okay? You should have, quite frankly, the temperature monitor, where you can monitor your own temperature, okay? You should have, quite frankly, if there is a concern, and particularly if you're in a higher risk group, you have some of those chronic conditions that put you in those higher risk groups, high blood pressure, diabetes, chronic lung disease, kidney disease, and other things, then you should have a finger pulse oximeter. You can buy these things for very little amount of money at Costco and at a lot of the farm, Walgreens, I should say, since Livonia is on here. So you can buy these things for not a lot of money. You should have your little toolkit at home that helps you help the doctor. And I want to couple that with the opportunity for you now with technology through telemedicine to reach out to physicians, reach out to your own personal physician, reach out to another service if you need to say, hey, look, here's what I'm seeing. Here's how I'm feeling. I can't breathe. My pulse ox is reading less than 90%. My blood pressure is way too high. Then now I can say, okay, now we have all of that data really right at our fingertips that helps us make those decisions. But I would say when you are in doubt, okay, it gets back to the basics. Knowing your risk factors, knowing what's going to happen or what could happen to you if you were to come down with the flu or COVID, and saying, hey, look, I can't afford to sit at home and wait around for this. I've got to go and be seen. And now we have technology and we have access, easier access than ever now, to reach out to physicians remotely before you even, I don't have to go home, but allow us to help you make those decisions while you're sitting there wondering what I should do. We don't want people sitting at home when they should be getting the care that they need.
Since we've mentioned access, Lavania Cannon, the role of the pharmacy as being an adjunct and an aid and a direct provider of care is certainly starting to change. I will say, Dr. Cooper, that my 96-year-old mother, who just had a bout of COVID, was well managed in part because she went to Walgreens and got her pulse oximeter, and that allowed us in the family to monitor her long distance and to tell whether or not she was getting in trouble. Talk a little bit about what you sort of see as the role of the pharmacy in providing some of these kinds of support tools.
Thanks, Dr. Tuckson. Perfect timing. I was going to ask you if I could chime in. I'm also a licensed pharmacist, so certainly I can speak as a pharmacist as well as a healthcare supervisor with Walgreens. Pharmacists are certainly integral to our communities. You know, we're at the heart of each community. Most patients live within 10 minutes of a Walgreens pharmacy. And so pharmacists are one of the most accessible healthcare providers. So not only we adjunct, we're part of the team, and we certainly want to make sure that every patient has a pharmacist that they trust, that they can go to get the information that they need. We talked a little bit ago about how important education is, whether it's knowledge about the disease state or even about the medications that you're taking. So, you're going to your physician to get diagnosed, but then you're prescribed medications. We want to make sure that you understand what you're taking, what to expect from it, and certainly if there are some side effects of what needs to be done next. And then we talked about prevention. Prevention is certainly a big piece of what we're discussing today, and vaccines play an integral part of that. At Walgreens, we offer many vaccines, flu for sure, COVID-19 and non-flu. And we want to make sure that the communities that we serve understand that we're there to educate. We're there to provide that access to care, which involves immunizations, and certainly to make sure that they're able to overcome any barriers to access. Sometimes that might be transportation, sometimes that might be cost. And we offer flu shot vouchers in partnership with the Department of Health and Human Services to make sure that those that are underserved or underrepresented can get an immunization, a flu immunization at no cost. And since we've started that annually, we have about 200,000 flu vaccine vouchers that we distribute. So we're able to protect at least 200,000 of our patients with this program. And then on top of that, obviously, just with our pharmacists being in the stores, being accessible, able to provide this service, hoping to continue to just ensure that the patients remain healthy. And I think another big key piece of a pharmacist is to ensure that the patients are educated. So we're there to make sure that they manage their medication properly, that they're taking it when they should, and certainly getting the benefit that they need from their medication therapy.
One of the things I want to make sure that the audience hears is that it is appropriate and, in fact, advised to speak to the pharmacist when you are adding new medicines to your protocol. One of the things that I know from my patient experience is that many African Americans have hypertension, and some of the drugs that we take are not good for taking some of the symptomatic things that will help us to manage runny noses and coughs and so forth. So I think you're telling us that it is okay to go up to the pharmacist, even though they are busy, and say, I'm feeling a little sniffly, I need to get something, but here are the medications I'm on. Is it okay?
It is more than okay. It is highly recommended, encouraged, and in my opinion, required. As a healthcare provider, I think it's important that we all work collaboratively and your pharmacist can help work with you and your provider to ensure that you get what you need to make sure that you are healthy and happy.
And one last thing on this point that I would hope that you would agree with me on, and that is this: whenever you are seeking care or getting care away from your traditional medical home, your regular physician or health professional, make sure you let them know ultimately what you are doing so that all the pieces come together. You don't want to be scattered all over the place. So let's make sure we keep good records and are able to do that. Let me turn to you, Dr. Fields, and try to understand one of the big challenges that we are facing with influenza is that we as African Americans, unfortunately, have a lot of pre-existing chronic illness. And I'm wondering whether or not you can help us to understand what the relationship is between having pre-existing health conditions and then getting the flu on top.
So, unfortunately, people of color populations, African Americans, disproportionately are impacted by things such as cardiovascular disease, hypertension, higher levels of obesity, diabetes. What we're dealing with is all of those other conditions predispose you to being more vulnerable to acquiring the virus and then having the virus adversely affect or even worsen not only what it can do to you itself, but exacerbating all of the other symptoms that you might be having. Because now you're adding medications, and as you just alluded to, some of those medications may not work with your current medications, which is why I absolutely love my pharmacy colleagues and being able as a nurse to say to a patient, you know, when you go pick up your medicine, talk to your pharmacist. Make sure that there's not interactions with your current medications. But this is why everybody must be aware of what their current health conditions are and understand what your treatment regimens are. And if you're going to be treated, if you're going to seek treatment in urgent care or an emergency room, you know, you're going to encounter nurses throughout the system because we are right on the front lines, again, as part of the team. Talk to the nurses about what you're dealing with. Bring your list of medications, or if you don't have your list of medications, I tell patients all the time, put your medicines in a bag and bring them with you. We can help you and tell you exactly what they are. But you must have a good understanding of your state of your health, your chronic health conditions, because they do and can make the experience of having influenza a lot worse.
Dr. Cooper, Dr. Fields mentioned right at the very beginning of his answer the impact on things like our heart. We do have a cardiologist in the house, so why don't we turn to you, Dr. Cooper, and what kind of things does the flu do or can do to the heart?
So let me just, I want to emphasize this right off the bat without a lot of rhetoric or hype. Having influenza increases your risk of having a heart attack by 10 times. Okay. So if you know already as a baseline that you are at risk, hypertension, you're overweight, you're African American, you're male, you're aging, you have hypercholesterolemia, you have a prior history of cardiovascular events, you've had prior strokes, or you know you're at risk for strokes. All of those categories, and perhaps some that I didn't even mention, you are at 10 times higher risk for having a heart attack when you have a bout of influenza. And we think, quite frankly, the data is still coming in and becoming more and more clear that with COVID, it's perhaps even worse because of the hypercoagulable and hyperthrombotic state that COVID creates. So if you have those, so it's so important to understand your risk factors. What's happening in the body? What's happening inside the body is that the influenza and the coronavirus create an inflammatory response. And you hear all the charlatans on social media and other places talking about inflammation. Well, to some extent, that is very true. And that inflammation has a significant impact on the lining of blood vessels throughout our entire body. And there's no other organ, and the blood vessels in that organ that are more affected, are more vulnerable to that than the heart. So the arteries that supply blood flow to the heart, if you have those risk factors, so what's happened over time is you develop atherosclerosis, a little buildup of some blockages there. Not something that we would need to do anything about at a baseline, except for treat the risk and lower your risk to the extent that we can. But in the case of an inflammatory process such as influenza on top of that, you've now increased your risk by 10 times. So It's so important. All the things we talked about, prevention, paying attention, knowing your risk factors and things like that is so important so that you don't become a victim of influenza as it relates to a cardiovascular event.
And by the way, Dr. Cooper, I do well know that you are a cardiothoracic surgeon and not a cardiologist. But
let me say this, Reed. I'm a cardiologist that operates.
Well said, Dr. Brown.
I'd say that to all my cardiology friends for the last 25 or 30 years. They're like, yeah,
I'm sure they appreciate that a lot. Yeah.
All right.
Dr. Brown, let's look at these issues from the viewpoint of the child. What are some of the things that concern you about a child having an exposure to influenza? What can go wrong?
It's really important that families understand this, just like you guys have been talking about in, adults, that adults can lose their life. So can children. Each season we lose anywhere from 75 to 150 children to influenza, right? And these are, as we've said again, these are preventable diseases. And so it's really important that the first thing that you do to protect your family from flu, because kids have the highest attack rate of influenza every single season, year after year. Your kids are going to, get exposed typically within, the season at some point. So the first thing that you need to do is get vaccinated so that they have a lower risk of even getting infected. It lowers your risk, typically anywhere from 40 to 60%. It also reduces their risk of being hospitalized or needing intensive care treatment if they do end up getting sick. Because we know that with vaccines, while nothing is 100%, certainly the difference between being vaccinated and unvaccinated makes a huge difference in terms of the severity of illness that children experience. And so kids can definitely get very severely ill, hospitalized, and certainly they can lose their life. So we want to make sure that your child is not in those numbers.
Dr. Robinson, I'm coming to you in a moment. We're going to talk about vaccines in detail, but before we do that, Dr. Fields, I want to look at one of the things that is just also very important to understand is that, as we mentioned earlier, we're in the midst of a COVID pandemic with lots of hospitalizations occurring. And now we have the flu season about to start in another month or so. What worries you about the coming together of both of those diseases at the same time?
So as I mentioned, the nurses are the largest segment of our healthcare workforce. So we're on those front lines. I'm really concerned, and we see it happen all the time, about the possibility of treatment delays, backups in the emergency rooms, overcrowding in our emergency rooms, trying to appropriately triage other cases that are coming in when we have high acuity levels. So the nurses are always there, but we're also dealing with healthcare shortages, and we have a shortage. We have a shortage of nurses. So we need to be very mindful, and I'm always concerned about even the nursing staff getting sick themselves, being exposed to the influenza virus or to COVID. And, we all know the risk. So I also want to make sure that I talk to my nursing colleagues and other healthcare professionals to make sure that you yourself also get vaccinated. We are all science-based professionals. We need to lead by example. So we also need to get vaccinated. But with these shortages that we already have occurring in the healthcare system, again, if we can keep you out of the emergency rooms, out of the urgent cares, because this is preventable with vaccines, then that is also what we still need to do, because we're going to see the emergence. We don't know what's coming with the next COVID variant, and we don't know how bad this flu season is going to be yet.
Well, listen, I think we can do everybody a favor here. Listen, the last thing we want to do is have the emergency rooms clogged up with all kinds of people with the flu preventable. And then you have the COVID people coming in. And then, by the way, everybody else. And so let's do us all a favor and let's avoid that. I'm going to turn now to vaccines and get Dr. Robinson and Ms. Cannon in this. Dr. Robinson, help us to understand what is probably the most important point about vaccines. Are they effective? And above all, are they safe?
Yeah, so thank you for that. So the short answer to both those questions is yes. Vaccines are safe and they are effective. Probably something that would be of interest to the audience to know is that when vaccines are manufactured, including the flu vaccine, about 80% of that manufacturing time is spent doing quality control testing. So this is to ensure that vaccines that are manufactured and ultimately administered to patients are safe. And one of the things that is important to underscore is that because we're providing vaccines to both people who have underlying illnesses and healthy people, vaccines have a pretty stringent threshold for being safe. So the bar is quite high in terms of trying to produce vaccines that are both safe and effective. In terms of effectiveness, I think one of the things that I want to call attention to is that standard dose vaccines are typically about 40 to 60% effective at preventing illness against the flu. And I think it's important to underscore that even though the vaccines are not 100% effective at preventing flu, that 40 to 60% protection is quite substantial. I'm just thinking about the 2017-2018 influenza season, which was pretty severe and lasted longer than, I guess, other influenza seasons in recent history. And when the vaccine was about 40% effective, even during that season, it prevented more than 7 million illnesses. It averted almost 100,000 hospitalizations and averted or prevented 8,000 deaths. So that vaccine effectiveness is quite important in terms of trying to prevent illness. And I know that there's certainly room for improvement when it comes to influenza vaccines. And if we have time in the program, I want to talk about some of the vaccines that have been particularly targeted for older adults.
And Ms. Cannon, one of the things that we are aware of, I think, is that you don't just have one kind of flu vaccine available to people. Are there different formulations? Do we have choices that we have to make when we come to the pharmacy to say, I want my flu shot?
And you don't necessarily have to make a choice. I will say there is a flu vaccine that is highly recommended for patients that are 65 years old and older. But generally, just a traditional flu vaccine is sufficient for anyone aged 6 months and higher. I will say, though, with us at Walgreens, certainly we do offer a flu vaccine. I know we have a lot of people who have a barrier to access of care. And so sometimes we get walk-ins. We are able to accept walk-ins where capacity allows. We do really highly encourage our customers and patients to make appointments to get their immunization, whether that's flu, COVID-19, or otherwise. So definitely want to encourage everybody to go to our website, walgreens.com/schedule vaccine, walgreens.com/schedule vaccine, or our Walgreens app to schedule your appointment. You can also call 1-800-WALGREENS as well to make that appointment. I want to go back to a couple of things. We talked about a lot of distrust that, Black and brown communities have within the healthcare system, whether it's vaccines or otherwise. I think it's really important, though, that we look at the education piece. And as I mentioned before, our pharmacists certainly are armed with the resources to support that. What we've done a lot at Walgreens is to make sure that vaccine equity is something that we've kept part of our strategy. And so we've held over 1,500 COVID-19 vaccine equity clinics, and we'll add flu vaccine to that as well. So it's really important that we get into those underserved and underrepresented communities to, ensure that they're properly protected as well. What we've also done is we donate immunizations to other countries as well with our Give a Shot campaign. And so it's important that as we are helping to protect those here in America, that we're also protecting others worldwide. So as you get your shot, you're also able to help others. I think it's just important that with vaccines that we acknowledge that, as Dr. Robertson mentioned, it may not be 100% effective, but it certainly is effective at reducing the spread. And that's what we need to do. We've talked about the twindemic with COVID and flu. Anything that we can do to prevent that illness, first of all, will help that individual patient, but will help us in this pandemic and certainly get to more of an endemic state where we can all hopefully be able to make some moderations that aren't so severe as what we've made the past 2+ years.
Thank you. And Dr. Cooper, I see your hand.
Yeah, thank you so much, Reed. I just wanted to piggyback on what Dr. Robertson and Ms. Cannon were saying. And so just keep in mind also that vaccines are very important. Vaccines can prevent disease. They're not 100%. But we also need to understand that there are also oral treatments for all types of flu. Tamiflu, for example, all right? In the case of the usual flu that we're used to, Paxlovid. And in fact, the state of Mississippi several months ago actually authorized pharmacists to distribute Paxlovid without a prescription. And I think that's a huge that's practical stuff that gets to the essence of the access issue, because access is what people really have a problem, is getting to me. And then on the acute care side, even when they leave the acute care setting, the hospital, the ICU, or whatever it is we're doing for them, what's that transition like? Where are they going to get those resources? It can be very, very challenging. So I say all of that just to say that our audience needs to understand that I really am a big fan of the Walgreens, the Walmarts, and the CVSs getting into the healthcare game, because it increases and expands access to care and access, quite frankly, to very, very needed treatment when you can't get a hold of your doctor, when you can't take off work and things like that. Very important to understand that.
If I just may add, Dr. Tuxton, though, Dr. Cooper, what you just mentioned certainly is a win, but it's a temporary win if we don't look at things that will update current policies to allow pharmacists to continue to provide the service that we provided through the pandemic. A lot of what we've done, whether it's through COVID testing, even COVID immunizations, and what you just mentioned as far as COVID treatment, is temporary. It's through, an emergency order. So we want to make sure that, anytime that you can support, whether it's policies or procedural changes that will help our pharmacists expand that care and sustain that care, build that infrastructure, we need that. Because as you said, it's very valuable.
Great. I'm going to come back to you, Dr. Brown, in a second and ask you to look at the vaccine issue through the lens of the pediatrician. But before I do, there's a question, Dr. Robertson. Our audience does not understand, how come we have to have a new flu vaccine every year?
That's a great question.
So the short answer is because the flu virus is tricky and it changes. So vaccines work best when they are well matched to the virus causing disease. So because every season there are new flu viruses, in order to provide optimal protection through vaccination, the vaccines have to change in order to incorporate those new viruses so that the vaccines can provide the best protection against the newly circulating strains.
So we've learned, I think, all of us, about the propensity of a virus to mutate or to change. It's the nature of what viruses do. We've all learned it with COVID. My goodness, have we learned it with COVID? Well, we've always known it. We just haven't thought about it with the flu. And that's why it's a great answer, Dr. Robertson. It changes every year. And so companies like yours have got to figure out what the new one will be like in time to make enough of a vaccine to get it to us. And thank God companies like yours are very good at what you do. Dr. Brown, about vaccination with kids, what do you say to parents when they come in, and are there more than one choice of vaccine, flu vaccine for kids?
Absolutely. There's definitely more than one, type of vaccine that children are eligible for. We certainly do not have a preference. We just want to get kids vaccinated. So in terms of efficacy, they all work really well, and there are limitations in terms of age. So most are shots, and there is a nasal vaccine that can be given to children 2 years and above. And we start at 6 months. So 6 months and up, we recommend everyone get their annual flu shot. And we want to try to get that completed optimally by the end of October. It's also important to know that the first season, when we start vaccinating 6-month-olds and those who are in that age group, they are going to get 2 doses, 4 weeks apart, the first year that they get the flu vaccine, to make sure that they get that optimal immune response. And certainly if you have a child who's under 9 years old who hasn't had at least 2 doses of flu in the past, flu vaccine, then they too are going to be recommended to get those 2 doses 4 weeks apart.
Good, thank you. Let me go back to you, Ms. Cannon, for a second and ask you about, given this role of the pharmacist as being a counselor at the point of distribution of not only drugs, but also vaccines, are there certain people who have certain medicines or certain conditions where they shouldn't be taking the flu vaccine?
The flu vaccine is recommended for anyone aged 6 months and older. At Walgreens, so we're only able to immunize 3 years and older. So to Dr. Brown's point, whether it's 2 years and up, whether they're getting the flu vaccine through a nasal mist or injection, we won't be able to do anyone under 3. But I would say, yes, it's recommended for anyone 6 months and older. And certainly now that we have experienced a pandemic, we want to make sure that we do everything we can to prevent illness, and a flu shot will certainly help us to do that with influenza.
And Dr. Robertson, if I were to read the label on one of your flu vaccines, would there be a warning of any kind that tells some of us that we should be more cautious than others?
Yeah, so anyone who's had a severe allergic reaction to a flu vaccine, if you had that vaccine before, you should not get that vaccine again. So that's the major contraindication to any influenza vaccine, having a severe allergic reaction. And if I could just piggyback on what Dr. Brown was saying about influenza vaccines in the pediatric population. So there's no preference in terms of influenza vaccines for children. But I just want to let people know that recently CDC, or Centers for Disease Control and Prevention, updated its recommendations for the 65 and older population. So there are vaccines that are preferred for that age group. Full disclosure, my company produces 2 of those vaccines. They're higher dose vaccines. And the reason why they're preferentially recommended for that age group is because these vaccines have been shown to provide better protection against the flu and flu-related complications compared to the regular flu vaccine. So that's new information. I think it's important for persons, especially older adults, to be aware that there are vaccines that are now recommended preferentially for them because they can provide improved protection against the flu.
Good. Dr. Fields, one of the things that we have touched on and mentioned is that that one of the unfortunate consequences of the COVID pandemic has been this escalation and highlighting of distrust between many people in our community and the healthcare system. When you and your colleagues are talking with patients, nurses who are so trusted by everybody in this country, what do you say to them that helps to overcome some of this unfounded distrust that keeps us from doing the things we need to do to preserve and protect our own lives?
So thank you for that question. And I tell people all the time, the level of mistrust that we see in a lot of the communities that we are in is an earned mistrust. So I hear myself always channeling, the words and the teachings of our great colleague, Dr. Kamara Jones, when she talks about how we need to acknowledge and recognize those past atrocities. So, yes, we talk about what happened with Tuskegee, with Henrietta Lacks, the Mississippi appendectomy, and we clarify and we talk about why those things happened, but now we bring it forward and we talk about why and what is put in place to make sure that things like that do not happen again. And in that, we really have to move on and move forward and deal with what we're dealing with in the here and now. So, I talk very matter-of-factly about this, even when I teach my nursing students about also how to talk to their patients about it. And I don't get into a lot of back and forth with people with their conspiracy theories. I listen. I hear them out. Because a lot of times, Dr. Tuckson, people just want to be heard.
Mhm.
And if you hear them out and you hear why they are doing or why they believe a certain thing, then you can help them and give them updated information and educate them. Everybody has the ability to be educated. But getting into sort of a back and forth tussle or confronting somebody with some of their really deep held beliefs before understanding their background, their history, and what they've been through is not the way to approach this. So this is what I know that I teach my nursing students, and what we talk about a lot in the National Black Nurses Association about the best practices in approaching patients dealing with these types of issues and mistrust within our medical system.
And
And
Dr.
I
Thompson,
would,
if I could add to
please.
that. Sorry.
Yeah.
So, Dr. Fields, I was just nodding as you were talking, because certainly could relate to everything you said. And conspiracy theories, definitely won't get into those. But what we found to be successful too, beyond just the typical education that we give as a pharmacist to a patient, is also partnering with community organizations and faith-based organizations. Because the more that you can get to the people that are
Yes.
trusted, we are trusted too. But it's those people that they see every day, that they hear from every day, that you've got to give that information to. So we found partnering with those community organizations has been helpful too, to debunk some of those myths and dispel those conspiracy theories, because to your point, it's definitely prevalent. And with the COVID vaccine, it just seemed to exacerbate that.
Yes.
So I just wanted to throw that out there.
No,
that
I'm so glad you did. And let me, as I asked the same question of Dr. Brown in terms of how she deals with parents, I want to give fair warning to my other co-host, Mr. Ellis Dean. Ellis and will take on the last part of our show, where we will ask you again to reemphasize treatment and what can be done in terms of the treatments. We've talked a little bit about that. We need to drill into that a little bit more so that everybody is aware of what's available to them. And also, if there are any questions in the chat we have not addressed yet, Ellis has been monitoring this behind the scenes. And so as I turn to Dr. Brown, then Ellis will join as our other co-host. But Dr. Brown, how does this distrust conversation happen when you're right there with a parent and everybody's nervous and everybody's anxious? What do we do?
Yes, I mean, we are pediatricians, and we're actually used to having these conversations every year, even with routine, immunizations. And so, just as Dr. Fields talked about, really asking patients what their concerns are, because I could launch into an explanation of something, and they may not be concerned about that at all. So, we really are here to learn from families and understand where they are, and have continuous conversations, right? So it may not be today that they're going to get their flu vaccine, but maybe they've taken the information that I've given them. We give them lots of different resources to go read about that's reputable. And then, oftentimes, because we can talk about also what your individual family's risk is, right? Whether someone has asthma or sickle cell, whether somebody's pregnant, right? Or maybe it's, your sister who watches the kids, right? Maybe she has something, right? So we also know a lot about our families that we can counsel and really explain why it's so important. And I think one of the biggest things is that folks don't understand just how dangerous flu can be. So really talking about that, and that the vaccination is the number one way to protect your family. And folks ask all the time, can you give it with the other routine immunizations? 100%. Yes, you can. They can be given together. They can also be given at the same time as the COVID vaccination. So definitely come in and get it. And we have it in our offices already. So call and make your appointments.
Great. Ellis, I'm turning it over to you, sir. Thank you.
Well, thank you, Dr. Tuckson. You have been a fantastic moderator for us this evening. There have been a couple of questions from our audience. The number one that's been asked multiple times is, and I'll throw this to Dr. Robertson and anybody else can jump in. Can you speak about influenza A and B? That's come up at least twice during in the chat room.
Thank you. So influenza A, there are a couple of strains that are included in the vaccine. H1N1 is probably the strain that a lot of people are familiar with. That was the cause of the 2009 pandemic. And there's another influenza A H3N2. Influenza A, those virus strains tend to cause pretty severe disease compared to influenza B, especially outside the pediatric population. But that's not to say that influenza B isn't of importance. Influenza B can cause pretty severe disease as well. But as a general rule of thumb, influenza A H3N2 is the virus that causes probably the most severe disease, followed by H1N1 and influenza B.
There's another question. This is probably for our pharmacists. Also, can the COVID vaccine or the influenza vaccine interact negatively with certain medications?
With certain medications, we definitely need to know your medication history. As we talked about before, really the primary contraindication to getting a flu shot is just being allergic to the vaccine itself. We do encourage that you get both immunizations, especially if you haven't received your COVID vaccine or your booster, if it's due. So yeah, no worries there. And certainly your Walgreens pharmacist can answer any questions, but we encourage you to get both of those so that way you're fully protected.
Okay. And then I'm going to ask one more from our comments, and then we'll do our kind of our final walk off as we give your final thoughts. So kind of start thinking about what you want to leave our audience with as we close it down here today. So this is kind of more of that sociological kind of question, and that is, what do you say to people who believe that local remedy is above the vaccine? I know you all have heard that probably many times. I'm taking my vitamin D, I'm walking in sunshine, I'm doing all kind of different things. What do you say to those people that are choosing to do more local remedies than relying on medications that are produced by pharmacies?
So I'm sorry, I'll jump in here. You know, one of the things that I will say to patients is, you can use your home remedies, grandma's chicken soup, or whatever it is, you know, you think makes you feel better as an adjunct to work with the vaccine. You know, let them both help you. But I don't ever try to take away anybody's, you know, home remedy, especially if it's not going to do any harm. You know, if they believe that something's in grandma's chicken soup, that's okay. Chicken soup is not going to hurt them. Now, if there's something that they're really, you know, I always ask what it is. And if it's some over-counter stuff, something that might be dangerous, then we have to have a different conversation. But those home remedies, they do something psychologically to help. You know, and I use some myself.
Dr. Robertson, you wanted to say something?
No, I wanted to echo Dr. Fields' comments. I think those are spot on.
Yeah,
I'll say to Ellis. Oh, I'm sorry. Go ahead.
Go ahead.
I'll say to Ellis that I wholeheartedly agree with Dr. Fields. Definitely, you know, we want to support you if you believe that that's helpful, as long as it's not, you know, harming you. But vitamin C, E, D, whatever vitamin you want to take, certainly take it, because it is definitely needed. But I think what we need to stress, though, is that these are preventable illnesses, and getting protected through a vaccine is what we need to do on top of that home remedy or whatever you've been told by grandma that works well. Yeah. So I would just say, just continuing to reinforce that it's preventable, and these vaccines are the key to doing that.
And I'm sure Dr. Brown would tell those parents, if you want to, you know, let's start them on their vitamins early on in life and make that part of their daily health routine versus trying to circumvent a pandemic in the middle of a pandemic.
Right.
I mean, I would actually say as the pediatrician, what I really advise is eating fresh fruits and vegetables, right? Eating whole grains, eating lean proteins, drinking a lot of water, right? And not relying on the vitamins. Most kids who are not picky eaters don't actually need a multivitamin. It also has not been shown in studies to reduce their risk of getting viruses and colds. We do have some evidence that honey is a natural antiviral. It certainly is not safe in children under 1. And there are no decongestants or cough suppressants that we recommend under 6 years of age. In pediatrics, there are not a lot of, medicines we're going to give unless there is an actual true, reason to get it. But certainly the vaccine has definitely been proven to be safe and effective. So, while we want you to live healthy, active lifestyles and eat nutritious, we don't want you to rely on supplements for that.
So, Dr. Cooper, my mom rubbing Vicks Vapor Rub on my chest wasn't an effective treatment for my cold.
I'm sorry, Ellis. She didn't prevent your cold. She made you feel better, and I'm sure the rub down was very effective. I have no doubt about that. That's very therapeutic, but unfortunately, it didn't change your risk for heart attacks.
Oh, you just broke his heart. Oh, sorry, Ellis.
Oh, it was. Yeah, I got picked on by kids. Like I smell like medicine.
I was going to say that smell though probably wasn't the best.
It's okay. I'm gonna call her after we get off the air. So as we're wrapping up here, I want to say first of all, thank you all for joining us. Thanks to all the panelists for being here. Fantastic. We got a 360-degree view we had the video of the really kind of dire interactive effects that having the flu could happen to your body. We had a representative from National Black Nurses Association understanding the nurses are there on the front line seeing that. And even though Dr. Fields is a professional, and I'll say it for him, nurses are frustrated when you come in with an illness that is preventable. Okay. I'm not reading his mind, but I'm reading his mind right now. Yeah. You should not be presenting to the emergency room or any other space with a preventable illness. You should be going to go see Walgreens pharmacist, get your vaccine, go see Dr. Brown, getting your vaccine in October, so you don't have to go see Dr. Fields or Dr. Cooper. Because when you see them, you're in a bad space. So,
well, I'll see Dr. Cooper. I think I don't know if I want to see Dr. Cooper.
No, but I will say this though, quite honestly. Through the National Black Nurses Association, we have over 115 chapters, 35 states, and the District of Columbia. Reach out to us. We are here to help and to educate. But you are right. Some of our colleagues are a little frustrated because this is completely preventable. We can help you not get sick, and that's what we really try to emphasize to everybody that we talk to in the programs that we push out at our local level.
Absolutely. All right. So we'll get to final statements. We'll start with Dr. Cooper.
Yeah. So I would say, Ellis, my final statement is this: prepare, prepare, prepare. You play like you prepare. And so what I mean by that is know your risk factors. I work in a hospital every single day. And I will tell you, in addition to all the other frustrations that have been expressed here, showing up, as Dr. Fields talked about, and with a preventable illness. But even when you show up with that preventable illness and you have no idea what medications you're on, you have no idea the last time you saw the doctor, whether you've had lab work, what your lab work looked like, you're diabetic, you don't know your hemoglobin A1C, you have high cholesterol, you don't know those things, quite frankly, are about that preparation. And I talked a little bit earlier about there's a few devices that you can have at home where you can help us help you. And then, so in addition to getting the vaccines and then knowing what your healthcare resources are that you can tap into immediately, as Livonia said, you got a Walgreens pharmacy. I've read this data somewhere is within X number of miles of almost 90+% of America, Absolutely. A Walgreens pharmacy. And so why don't you go down there if you're in that neighborhood, knowing that's where you get your stuff, introduce yourself to the pharmacist when you go pick up that next medication. Hey man, this is what I'm suffering from. They are required by law to maintain your privacy, and they can bring you aside. So you develop those relationships with your family. Tell your wife and your kids what's going on. Really begin to be proactive with your health. I can't tell you, in my 30 years in healthcare, it's probably one of the most frustrating things is that people aren't using the very basic resources that they have access to. And then we complain about it. The most common complaint: can't get to you, can't call you, doc. You won't call me back. Well, I've got 15,000 other people calling me. And so, but you can do so much for yourself. And that's what my message is on this forum. Empower yourself by just doing some very basic, simple things that you can prepare for every day, just like you think about what you eat, your exercise, and those things. Prepare, prepare, prepare. Be ready to answer those questions. Help us help you.
Dr. Brown.
That's such a great message, Dr. Cooper. And, we would say the same thing. We really want families to understand that flu is a potentially very serious illness. And again, all children under 5 are at high risk, and even more so those who are 2 and under and have high risk disease. So you want to know about your child's disease. Say if you have a child who has asthma, right? Do you have your albuterol, ready to go at home just in case, right? And so you want to make sure that you get vaccinated on time, 2 doses if you do need it. Most kids only need 1. And then you've checked your box. And then you want to make sure that you're staying away from others if you're sick. And if others are sick, make sure they're staying away from your family. But this is going to protect not only you, but your child and our community at large.
And Dr. Fields?
So we encourage through MBNA to take a loved one, take a partner, take a friend, and do it in groups. Go get your flu shot. Make it a group activity. Make it something, because if not for yourself, think about those who are around you who may also wind up getting sick. The same thing with COVID. You didn't want to spread COVID, and you don't want to spread flu.
I love that. Go as a group. Lavanya.
Thanks, Ellis. Yeah, Dr. Cooper actually said it well. Thank you, Dr. Cooper. But really, when he said, help us help you, get protected and do it for yourself, but also for those that you love. And to Dr. Phil's point, take those that, are in your family that haven't been protected. It's important. This is a serious illness that is preventable, but we need you to take that first step to leave your home, whether it's to go to your pharmacy, whether it's to, go to whom you trust, but we need you to trust someone and make sure that you're getting the proper information. So I know that we have it scrolling across the screen, but all of our Walgreens pharmacies and pharmacists are able to help you educate yourself and those that you love to be protected, but then also to make sure that you know what to expect afterwards. So trust us, please, because we're here to help.
And Dr. Robinson, final word.
So my panelists pretty much said it best. I'll just underscore that flu vaccination is the best way to prevent the flu. Flu vaccines are safe. They are effective. If you have any questions, please reach out to your trusted healthcare provider. Don't play Dr. Google. If you have questions, go to a reputable source to get accurate information so that you can protect yourself and your loved ones. Don't gamble with your health. Don't gamble with the health of your loved ones. Do the right thing and get vaccinated to help protect yourself and your family and loved ones.
I couldn't have said it any better. I will give one shout out, and that is to our partners at Families Fighting Flu. They were the group that sent that video over to us that we played earlier in the program. So I do want to give them a shout out for being a part of this program. I want to thank our partners also at Bio for helping us put this together. Dr. Cooper, Dr. Brown, Dr. Fields, Dr. Cannon, Dr. Robertson, y'all have all been fantastic. It has been a wonderful joy to watch, and there has been some fantastic comments coming through about this information. I love the fact that y'all are real, and I love the fact that we are here really to save lives and getting the flu vaccine. And I know we're in the COVID space, right? And COVID is dominating the headlines, and still get your booster. If got no boosters been approved, go get your booster. But the flu has been around for over 100 years.
Hey, Ellis, I want to say this. Thank you, and thank blackdoctor.org. This is amazing, man. I'm telling you, I've been in this game for 30 years.
Yes.
And what you guys are doing is so important. So when we talk about resources, I want to encourage your audience, go to blackdoctor.org.
Yeah.
Look, all this information is on there. And if it's not, guess what? If you ask for it, they respond and they will help you find that information. They'll help you find a Black doctor. Somebody who will listen to you. So let me say this, man, what you all are doing, and I've been in this game, like I said, for 30 years. I don't look like it. I know I'm, still young, but the fact of the matter is what you're doing with forums like this, the forms you've had in the past and the forms that are to come, we need to say that to you. And we need to get more people like Walgreens, Walmart, Families First, and everybody else on board with supporting what you are doing. I don't have a problem saying that, man. This is really serious stuff. And you all have created a platform that people can trust because they know they're going to get this firepower right here, led by Reed, in this kind of form, talking about something that is right up on us, is going to be happening. We're here within a month. So I just wanted to say that, my brother. I appreciate what y'all are doing over there.
Well, I thank you. I thank you for that infomercial for BlackDoctor.org. That's been fantastic. We're probably going to cut that up and share that. But no, we really, everybody that works at BlackDoctor.org it is a passion project. And so, yes, it's our job, but we believe in what we're doing. We believe that we're saving lives, and we believe that our goal is to eliminate the life expectancy gap. But that comes from getting people educated, to what you talked about, Dr. Cooper, making people their own best health advocate. And you only do that by getting them the information that they need to arm themselves. So when they go see the doctor, they'll get those screenings. When they go see their pharmacist, they'll ask questions instead of grabbing that bag and running out of the door like many people do.
Right.
Have those questions. And so we do that by arming them and empowering them to say, no, you need to go and do this. And so we're going to be here. Been around for 17 years, and we're going to be here continuing until Black folks stop living sicker and dying younger, and that's the real. So I don't know. I was embarrassed by that, Dr. Cooper. Appreciate that. Appreciate the love. Thank you so much. Thank you, everybody, for joining us this evening. We're going to re-air this tomorrow. So if you missed it, tag a friend, share it on your page. We got to get this information out. Dr. Brown said it. Get your flu shot by the end of October. Make that your goal. Flu season is starting soon. Make that your goal. Get it. If you need to talk to your doctor, go talk to a doctor about which one is best for you, because there's multiple out there, but still get it. And again, thank you all for joining us, and we'll see you next time.
Take care, my brothers. Take care, everybody.
Bye-bye.